Thank you very much. My name is Julia Endean. I'm so thrilled to meet you all and see you all in person today. As mentioned, my project was an evaluation framework for Wakeful Wednesday and Thankful Thursday, which are programs that run out of BC Children's Hospital, their Centre for Mindfulness. As we begin our session today, in the spirit of mindfulness, I'll invite you to join me in a mindfulness moment. So I'll invite you to close your eyes or soften your gaze. Feel your feet on the floor and bring awareness to your body. Ask yourself, how am I feeling today? On your own time, take a deep breath in and feel the cold air on your nostrils. And release that breath, feeling the warmer air that exits. Take a few more deep breaths to yourself and allow yourself to be present in your body. You can introduce some movement into your body if that feels right for you, in your shoulders, your fingers, in your neck, allowing your movement to be organic, listening to what your body is telling you. And on your next in-breath, hold for a moment at the top. And as you breathe out, release the practice and bring your focus back to the room. Thank you for sharing that moment with me. I'd like to acknowledge the inherent rights of Indigenous peoples in BC, and that the land on which BC Children's Hospital stands is the unceded traditional territory of the Coast Salish peoples, including the Musqueam, Squamish, and Tsleil-Waututh nations. Throughout the practicum, I've been remotely tuning in from the stolen land of the Lekwungen, including the Songhees and Esquimalt peoples on whose territory we gather today, and where I live, work, and play, and I humbly acknowledge the Wasanich and the Lekwungen peoples whose historical relationships continue with the land to this day. As an overview of my presentation today, I will start by describing the programs and what I was tasked with, and I'll describe our approach as a team, and then I will tell you what I completed, my deliverables, and how we decided to collect data. I will then close by sharing with my reflections on the strengths and challenges of our process and my key learnings and takeaways, and importantly, end with my acknowledgements. I'm going to throw a lot of adjectives at you here. The programs are informal, virtual, drop-in, facilitated mindfulness sessions. They're open to staff and trainees at BC Children's Hospital, Women's Hospital, and PHSA. Wakeful Wednesdays occur in the evening, and they are monthly 45-minute sessions. Thankful Thursdays are weekly, occurring at lunchtime, and are about 20 minutes long. Their goal, collectively, is to create a more mindful healthcare environment and culture by providing tools and practices that enhance well-being and professional life. What was I tasked with? My task was, in collaboration with the core team, to lead the co-creation of an evaluation framework for those programs. And my practicum supervisors encouraged me and challenged me to think, how can we embed mindfulness into the development and implementation of the evaluation? This was a central consideration, and a learning I'll take with me is practicing what you preach and acting with intention. How can we improve our process and approach to better align with our beliefs, goals, and intentions? And why are we doing things the way that we are? A little word cloud for you. We love artistic approaches here. In practice, employing a mindful approach followed a couple of principles. We applied a mindful communication approach, which encourages presence, emphasizing deep listening and loving speech. The approach we took allows for participants to choose how and if they wish to interact with the evaluation, making a conscious effort to reduce burden and provide choice as much as possible. My week at a glance followed something similar to this. On Monday morning, I would meet with the 2 full-time staff at the center, and I would bounce ideas off them, brainstorm, and they would help guide language at some points and give their thoughts and feedback on what I'd been working on the week prior. We then had a core meeting in the afternoon where I had 15 minutes with the whole team to present my ideas, so I had to be very clear and concise and flexible. A lot of times ideas were thrown out, and I had to adapt in the moment and then for the rest of the week. On Tuesdays, I would review with my supervisors for about an hour, and they would sometimes translate what we did or what I heard on Monday that I might not have understood based on their history with the folks who are in the core team. And for the rest of the week, I would focus on doing more research when necessary, which was every week, and making updates and edits and developing upon my ideas, and then preparing how to present the following week so that my ideas were clear, so that I could justify and advocate for myself and my ideas. So what did I do? I led the development of the following documents. First, a document explaining our approach to evaluation, how it was collaborative and mindful. Second, a process and justifications document, which explains the story of how we arrived at our decisions and includes evidence that backs up the proposed methods. And then an implementation guide, which includes timelines and language for emails that invite participation. And I've also included a draft evaluation report so that it's easy for them to just slot in information. Finally, I created fillable forms to be completed and stored in an organized manner. After many conversations, 6 feedback streams or data collection streams have been selected and refined. The first stream is facilitator interviews, which were selected for their ability to provide rich insights into the facilitator experience and also serve as an annual check-in to make sure that the center is meeting their needs. For participants, we decided on focus groups, and we've created 2 question sets that will each be offered every 6 months. Reflection activities have been created for each of the focus groups, and the moderator can choose which activity they would like to integrate into the 30-minute session. The third feedback stream is in-session polls, which were chosen to quickly capture insights using a Likert scale. Each poll has 2 questions, and they'll be offered once each month, rotating through annually. The fourth stream is more passive, and we called it field notes. When present and able, a core team member will take notes on a journal-like format. This was included as I noticed that often insights are coming up in session that weren't being captured, and the notes or the prompts for the field notes are 1, what did you notice, and 2, what did you learn? Finally, we'll track attendance by polling statistics, and a feedback form will be made available for participants to give feedback at any time. And this was included as the team mentioned they often receive feedback by email, but there was no organized method for them to collect those insights and take action. Moving on to strengths and challenges. This is a Venn diagram to show the significant overlap that inherent strengths were also a source of challenge. On the left side, the supportive environment really grounded me and made the project feel possible and fun. And on the right side, the short timeline was the limiting factor, especially with the culture of reflection, collaboration, and co-creation. It would have been really helpful to have more time to allow project partners to digest information. And this challenge was addressed through the process document, where the project partners can revisit and see why we chose to do the things and sort of our process there. Continuing along the middle, the project partners have very diverse perspectives, which is an inherent strength, but it was at times challenging to incorporate. A layer on top of that is that each of us individually also change our minds and as we reflect and we gain new ideas. And generally speaking, adaptation and change were the name of the game. Finally, I put absence closer to the side of a challenge than a strength, referring to project partners being absent at different times. And since the project moved so quickly, it required time and effort to ensure that folks' perspectives were included. My learnings, I like to use the framework, what will I start, what will I stop, and what will I do more of? I will start incorporating mindful moments in my work. I will stop underestimating the time it takes to collaborate, and I will do more of listening to understand instead of listening to respond. Applying skills after learning, after I haven't had a break in 7 years from education, taking the time to apply has been really valuable for me. Seeking feedback on my work, no matter what it may be, and advocating for my ideas. And finally, I would like to acknowledge my lovely practicum supervisors, Shar Black and Caroline Walter, as well as the core team at the Center for Mindfulness, Dr. Zoom Vo, Joanna McDermott, Jeanette Fong, and Sarah Hashmi, as well as the wider health promotion and projects team at BC Children's Hospital. My lovely instructor, Dr. Mira Debar, and Ari Spence, thank you for reviewing my paper, and to my wonderful MPH peers. Thank you. I'll keep up my acknowledgements while I open for questions.